Well, the Global Health Initiative, PEPFAR, is marking its 10th anniversary. Africa 54 health correspondent Linord Moudou joins us now with a closer look. Lino.
Hello, Vincent. Hello, everyone. Well, now 10 years old, and with a growing report card, the PEPFAR leadership invited members of the faith community and U.S. lawmakers to a recent celebration. And the event highlighted how PEPFAR has made a difference in the global fight against HIV/AIDS. In addition, it was a closer look at the role of faith-based organizations in the dream to create an AIDS-free generation. The U.S. President's emergency plan for AIDS relief was launched a decade ago by U.S. President George W. Bush. Faith-based organizations, along with other non-governmental organizations, received billions of dollars to implement the initiative. Senator Lindsey Graham of South Carolina calls PEPFAR a smart investment.
As you look over all the money we spend at the federal level, at home and abroad, I can't think of a better example of where relatively small amount of money, and that's not to say that $5 billion is small, it's not. But in terms of the federal budget, it is. What impact do you get? This is absolutely stunning. And the goal is to transition, to have host countries be able, where they can, to take these programs over. So I'm telling the American taxpayer this is a smart investment. We're building friends and allies for the future. We're doing the right thing.
And Ambassador Dr. Eric Gooseby, the U.S. Global AIDS Coordinator, spoke about the critical role of faith-based organizations in tackling HIV/AIDS.
From the earliest days of the global AIDS response, faith-based organizations have played a pivotal role and unique role in engaging communities, delivering life-saving services, and strengthening community clinical linkages for greater access and retention. At the outset of PEPFAR, now nearly a decade ago, we relied heavily on faith-based organizations, including many of those represented in the room today, to help stem the rising tide of new infection and AIDS-related deaths, especially in sub-Saharan Africa.
And now joining us in the studio for a closer look at the role of faith-based organizations is Reverend Samuel Nixon Jr., co-founder of the African American Unity Caucus and board member of the Pan-African AIDS Network. Reverend Nixon, welcome to the program.
Thank you very much.
So we heard how Ambassador Gooseby mentioned the importance of faith-based organization. Can you tell us, with regards to the Pan-African AIDS Network, what is the approach in addressing HIV/AIDS? Do you focus on specific areas?
We focus on different areas there. The general focus of Pan-African Christian AIDS Network is helping to educate and galvanize the faith communities across Africa in terms of addressing HIV/AIDS and eradicating it and trying to reduce it and getting to zero.
And how do you do that?
We do that through infrastructures in each country. Okay. One of the distinctions of our organization is that it is, as a grassroots-based organization, we are formulated through the church leadership on the ground in each country. And depending on how they come together, each one determines the best way within their country's structure to respond to HIV/AIDS through the leadership of the churches, some of the non-governmental organizations that work with churches, and also collaborations with other agencies that are in the country.
Now, 10 years ago, PEPFAR was launched, and when was your organization able to benefit from it, if at all you do benefit from it, and how has this impacted your work?
We actually, the PACANET USA, which is the U.S. side, and PACANET in general, which is the Africa side, are two organizations that work in collaboration. We were founded in 2002, PACANET, in the country, in the different countries of Africa, originally coming out of Botswana and developing what we call country coordinating networks. We have not directly benefited in terms of funding from PEPFAR. We have been working in collaboration with organizations who have been funded by PEPFAR. And our work has been a significant contribution to helping to secure volunteers who have galvanized around the areas of education and prevention, counseling, treatment, testing, and support to families living with HIV and AIDS and prevention of it. So
What type of impact have you seen on the ground over the years as you are working in Africa? What type of positive impact, or if none?
we have seen positive impact, and it has been in mainly several areas. One has been in the awareness of people in the countries of what HIV and AIDS is, to be clearly aware of how it starts, how it spreads, and ways that they can prevent it. So that education has been strongly reflected in the congregations and the communities we serve. Counseling and testing wise, we've been able to get more resources to people in villages that typically have been left out before. So we've been able to bring that to fore. And then thirdly, which more significantly in many ways is in terms of the capacity of the church and the faith community to help strengthen people's collective response to HIV/AIDS.
Well, Reverend Nixon, thank you so much for joining us. That's all the time we have.
Okay, thank you very much, Linord.
And that was the Reverend Samuel Nixon Jr. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.